Parkinson's is a chronic and progressive movement disorder, meaning symptoms continue to worsen over time. The exact cause of Parkinson's is unknown, but is defined by the loss of dopamine, which then causes many of the symptoms, and currently there is no cure. However, there are treatment options to help manage the symptoms. The average age of diagnosis is around 65 years old, however young people are able to develop the disease. Parkinson's is the second most common neurological disease in Australia after dementia, with around 32 Australians diagnosed every day and an estimated 10 million people affected worldwide. The symptoms that are most well known are motor symptoms such as bradykinesia, which is slowed movement, rigid muscles, resting tremor, usually in the hands, posture and balance problems. There are also non-motor symptoms which can cause cognitive impairment, which can be mild memory difficulties such as multitasking to dementia, sleep difficulties, loss of smell, swallowing problems and many more. Parkinson's is caused by a loss of neurons in the substantia nigra, which is an area of the brain related to a person's movement. It is thought that a toxic form of alpha-synuclein contributes to the disease growth and is used as a hallmark for the disease. The loss in this area causes a deficiency in dopamine levels by lowering the amount of dopamine that is able to undergo neurotransmission to further parts of the brain. This causes dyskinesia, which is an impairment of a voluntary movement. Parkinson's disease, as mentioned earlier, occurs upon decreased levels of dopamine. There are two outlying factors. If dopamine levels are too low, this will result in Parkinson's disease. However, if dopamine levels are too high, there will result in schizophrenia. Increased levels of dopamine result in schizophrenia as there is an overstimulation in the brain and excess sensory information is being received, causing difficulty with concentration. Most treatment options for Parkinson's rely on increasing the dopamine levels in the brain. But to first get your drug into the brain, it has to pass through the blood-brain barrier, which is highly selective, in order to keep the brain safe from foreign things. In order to get dopamine into the brain, you'll have to use L-DOPA, a precursor for dopamine, which is able to cross the blood-brain barrier and then become dopamine once inside the brain.
Levodopa was introduced in the 1960s. It still remains to be the most effective drug to treat Parkinson's disease. It is prescribed to patients to enhance their levels of dopamine and is taken 3 to 4 times a day. The early indications of whether levodopa is a success or failure can be seen by the improvement against stiffness and slowness. Side effects of long-term use of levodopa includes dyskinesia, the failure to control muscle movements. However, most of the side effects are psychiatric and include anxiety, confusion, vivid dreams, hallucination, and sleepiness. Levodopa can also affect social behavior and impair learning functions. However, levodopa causes the least psychiatric side effects when compared to other drugs and greatly improves the patient's life for many years to come. Deep brain stimulation is a surgical procedure that is also currently used to treat the symptoms of Parkinson's disease. Right now, this method is only used for patients who cannot control their symptoms with medication. A neurostimulator is implanted in the brain to send signals to control movement, and so it blocks the abnormal signals that causes the Parkinson's disease symptoms. This procedure does not damage any brain tissues or any nerve cells. A new method in understanding Parkinson's disease was found in the study of somatic cell reprogramming. It allowed risk factors of Parkinson's disease such as aging, genetics, and the environment to be reprogrammed genetically. What is essentially done is that they use the patient's cell or edit the gene of the existing cell to generate isogenic cell lines. This is done because of the mutation of the specific cell can be studied in isolation. When this is done with other model systems, reprogramming technology can help identify and test new treatments for Parkinson's disease. Recently, a drug called nilotinib was approved by the FDA for leukemia, has also helped improve awareness, motor skills, and non-motor function in patients with Parkinson's disease in a clinical trial. The use of nilotinib in smaller amounts was well received with no serious side effects. Researchers have also found that the drug penetrates the blood-brain barrier in amounts greater than dopamine drugs. A recent study performed by the Mount Sinai School of Medicine in 2012 discovered a new delivery method for levodopa, which is traditionally taken orally. However, they have found that if it is administered via gel injected into the small intestine, the medicine lasted within the body for at least an extra 2 hours.
Created using Powtoon.
The reason the gel is more effective is because it is administered directly into the intestine via a portable pump connected to a tube implanted in the intestine and thus bypasses the stomach, which allows for rapid absorption. Another study looked at transplanting dopaminergic neurons obtained from bone marrow and fetal brain directly into the striatum of patients, replacing the damaged cells caused by Parkinson's disease. However, the main concerns with this method is that the fetal brain tissue is difficult and ethically challenging to obtain. Also, another major setback is that the disease may destroy the newly transplanted dopaminergic neurons.
As you can see, not everything is known about Parkinson's, but research has come a long way. This is in the form of treatment, and hopefully a cure, which is somewhere on the horizon for the many sufferers of this debilitating disease.
Created using Powtoon.